Endometriosis is a problem because it affects many women, and it leads to symptoms which have in the past always been attributed to kind of normal women problems. And with that attitude, a lot of women have been affected by a delayed diagnosis. And once one makes a correct diagnosis, it becomes possible to treat the condition by various means I will discuss later. But one can maintain a good quality of life and maintain fertility, improve things for the women who basically are affected by a condition which goes along with a chronic inflammation of the pelvis, which can take many days out of their life, and therefore affects them in a very negative way. The symptoms of endometriosis are typically lower abdominal pain, painful periods, pain with intercourse. And this particularly bad around the time of the period, and it can be particularly pain around ovulation. But it's not completely certain, and it doesn't happen reliably around this time. Some women are unfortunate enough to have endometriosis, which affects the bowel, bladder, ureter, and this locations can lead to problems, for example, with interference of the bowel function, or with obstruction to the ureters, so that the kidney function out of a sudden could be in danger. However, this is the worst spectrum, and I see in 1 year only a handful of patients with such a high degree of severe endometriosis, where the vast majority of patients have pain and often can be helped just by providing pain relief and suppressive treatment. However, the suppressive treatments need to be very much individualized to each patient. Well, the causes of endometriosis are not completely clear. There are several theories in competition why it occurs. Some advocate a concept where when a woman has a period, that the blood runs into the abdomen, and with that, the cells from the lining are deposited in the abdomen, and they start growing there. Another concept is that the cells just change their activity, as we all have in our cells the potential for many functions. So for some reason, which is not known, the function of the cells in the pelvis can be interfered with, and the woman out of a sudden develops these small, initially just blood deposits, blood blisters, which can move on towards scarring or nodules or cysts in the higher degrees. It is not clear what caused this, and stress is certainly not a factor, but it causes you stress because you got a chronic pain problem, which can affect your mental health and your relationships. So it is important to have a good diagnosis at an early stage and start with a treatment when necessary. Now, endometriosis requires treatment in various ways. It very much depends on the tolerance to the drugs, which are usually progesterone-only pills or the combined pill, which would be easy, but many women don't tolerate the pills particularly well. And then one needs to find alternatives or progress towards minimal invasive assessment with a laparoscopy, look inside the tummy, establish what stage it is, treat and remove endometriosis so that one can try to have no hormonal suppressive treatment, or one can try for a pregnancy. The pregnancy would be the way without a treatment, but obviously starting a family is a big decision and shouldn't just be based on this condition. All in all, one would say the endometriosis can get better, but it's very rare. It usually, unfortunately, it gets over the years slightly worse, and it requires expert input to really individualize and get the treatment right for the individual person. And so we often can help you a lot.